Bismillahirrahmanirrahim. First of all, I'm extremely thankful to the organizers of this Annual Symposium of Pakistan Pediatric Association Punjab for inviting me to talk on the subject which is the theme of the conference. This talk was supposedly going to be given by Professor Ghuffar Billu, and I don't think myself eligible to justify the task, and it's very difficult to be in the footsteps of a big man like Professor Ghuffar Billu. But nevertheless, I would try to just express my thoughts on this subject. I think first of all, you are all aware that the childhood is very, very important as regards the assessment or gauging the development of any country is concerned. The country's progress is based on the health indices related to the child health primarily, but also to other economic and other welfare indices. But primarily it's the child health which is important, and this is given importance worldwide because children are the future asset and hope of any nation. They are the builders of the future nation. So it's important to safeguard their health. So if the most important indicators of social development is the survival of children beyond the period which is the most vulnerable period, and especially in children under 5 years of age, and interventions, if these are to be carried out, these need to address the children who need these interventions the most. So that would highlight the importance of equity in child health. Overall, child mortality has been a major global public health problem, and over the years, nations have been striving to improve the child health of their country. And if we look into the statistics, starting from 1990, there has been significant improvement in the survival of children throughout the world, both in developing countries as well as obviously in the developed countries. But still, the mortality is quite high, and even today, 6.3 million children under 15 die every year, and out of these, 5.4 are children under 5 years of age. The sad aspect of this statistics is that 90% of these deaths are taking place in countries which are relatively low middle income countries. And even today, 6,400 newborns die every day, and this contributes to overall 47% of total child health, especially in low middle income countries. Now, if we go over the statistics starting from 1990, which was the starting period for the Millennium Development Goals, which were started in year 2000, so there has been a significant improvement in terms of under 5 mortality rate, almost 60% improvement in the under 5 mortality rate, and same is true in infant mortality rate. And though that much progress has not been seen in neonatal mortality, but still there has been a very significant improvement in the overall mortality in all these three groups. Now, if we compare today with 100 years, statistics 100 years back, in 3 basic parameters related to child mortality, the poverty and the education. Now, starting from compared to 1820, when 43% of children, they used to die before 5 years of age, 84% lived in extreme poverty, and 88% of people, they were illiterate. This was the situation in 1820, but now after 100 years, you can see the progress which has been there. So would that mean that by almost any measure which would determine the progress of today, is this the best time for children to be born in this world, so as to survive, so as to have the right, all the right of survival and development and health? Though the situation has changed dramatically, but still there are problems. Because though this is the old slide which generally is shown everywhere, but if we see that out of these deaths, even today, about 6.4 million deaths, where are these deaths occurring? So these are occurring in these areas of the world, which so to say, in sub-Saharan Africa and as well as in this Indian subcontinent region. So, and if this, we just consider this as just the reorganizing the map of the world, so these are the areas where majority of deaths are taking place. So that would mean that these are not the safe places for children to be born. Though the place of birth of any child should not decide the destiny of that child, whether he is going to survive or whether he is going to die. But the truth is contrary to it, and this is very bitter truth, because children who are born in less privileged areas within the different countries, and also within the same country, we see that there are disparities within the same country. The situation is altogether different. Though every child has right to survive, so the child has equal right, but still there are disparities which would put the child in danger if he is born in this part of the world. Now going to the Pakistan statistics, though these are again very encouraging statistics, as has been shown recently, that we have also improved in under 5 mortality, infant mortality and neonatal mortality, almost half the reduction of under 5 deaths in under 5 age group, under 1 year age group, but neonatal mortality has not decreased that significantly, and that we know that there are some obvious reasons for the obvious factors which have not, the child survival resolution, we have not seen that much in the newborn. It's always wise and it's always required to see the conceivable causes of deaths as well as the problems which the children are facing, so as to build strategies, so as to make plans for the survival of children. Now these figures hold true for all the developing countries or low middle income countries, where neonatal deaths contribute to almost 44-45% total deaths, and remaining would be because of pneumonia, because of diarrhea, and the same old story that goes on, all these vaccine preventable diseases, though there is contribution by the non-communicable diseases, etc. as well. Now it's important that knowing that these are the problems of the children, so the strategies have to be made accordingly and the plans have to be made accordingly. As you all know that 8-point Millennium Development Goals, the starting point of which was 2000, and the target was to be achieved in 2015. The world achieved these targets. Some countries achieved, Pakistan could not achieve those targets. But these have been replaced by the SDGs, or Sustainable Development Goals, in 2015. 17-point Sustainable Development Goals. These are there, though the targets are very, very stiff, very ambitious targets, but still the Sustainable Development Goals that provide us the framework and the platform on which to work so as to improve the health of the children. Now, if we see that the causes of mortality, generally it's not one cause. Generally, more than one cause is operating in children, and especially in developing world, where there is malnutrition, where there is anemia, where there is diarrhea, where there are other vaccine preventable diseases or various other issues are there. So these would compound the effect. So it's not that one disease would be responsible. So multiple problems are there which would have effect on the child. So the diseases are sailing in the same boat in that particular child, and to be successful in improving the childhood mortality and morbidity, we have to address all these issues. Nutrition is very, very important. Nutrition is important, first of all, in the first 2 years, the growth of the child is almost totally nutrition dependent. But besides that, malnutrition or inadequate nutrition is responsible for almost equal 50% of total deaths, directly or indirectly. It's the common denominator in all these deaths which are occurring, and nutrition and malnutrition and disease, they have synergistic relation with each other, because malnutrition would predispose the child to development of various diseases, and ultimately this would lead to decrease in the growth of the child, and he would more be predisposed to these diseases. So vicious cycle would be established. Again, if we see the improvement since 1990, the world has seen improvement in terms of deaths because of malnutrition. As we see here, deaths from malnutrition by age 1990 till 2019, there has been a significant decrease. But still, as regards the developing countries are concerned, out of perinatal period, infections and malnutrition, these are the major causes of deaths in these countries. In undernutrition globally, there have been significant gains, that 60% reduction in stunting is there, and that is translating in terms of the number of children who are now stunted. But still the problem of the wasting that is there, but wasting has also improved, though the problem of overweight that has increased since 1990 till today. If we see the situation overall, taking into account both the developed as well as the developing world, the world is not actually able to achieve the targets which have been set by the Sustainable Development Goals, because by 2030, the total stunting rate that should decrease to 12.2%, total wasting rate should decrease to 3%. And you can see Pakistan is standing at around 40% continuously for the last 2-3 decades. That is there. We have not been able to improve our situation. Though there in the world would blame different, like COVID conflict has been blamed as a hindrance to this progress, which should have been made during this period. Now, I would take you to the National Nutrition Survey of Pakistan 2018. This is the latest nutrition survey, which shows here that underweight prevalence is still around 29-30%. Stunting is there 40%, and this has been there almost continuously for 3-4 decades. All the nutrition surveys, they are indicating that the stunting is remaining at the same level, and the overweight prevalence is 9.5%. Unfortunately, the cycle of stunting, that is a vicious cycle, because if the child is short, that would ultimately that there would be short mother, and she would give birth to a short child, short or underweight child, and this would have effect that. Stunting, not only that stunting is to do with the concern of the family that the child has not gained adequate height, but this has transformed, this reflects in the total country's economy as well. Because whenever there is stunting, this would have effect on the brain growth of the child, as this has been shown here, that if the child is well nourished, this is the brain growth, both in terms of gray matter, white matter, and cerebrospinal fluid. So there is a significant impact on the brain growth of the child, which would ultimately give rise to the impaired brain development, lower IQ, and this ultimately would be reflected in the total world's economy. Now, in Pakistan, it's said that Pakistan loses almost 7.6 billion annually of its exchequer because of the malnutrition. And the world, according to the World Bank figures, if there is a 1% reduction in the height, which is during the childhood, that would have affected the economy by 1.4%. So you can well imagine that the country's economy would be stunted. So it's not merely that it relates to the family that the child would be short stature, but this would have ultimate effect as well. This would also lead to development of maybe certain non-communicable diseases in future. So there is a longer impact of the child because of stunting. Now coming to the hidden hunger, the micronutrients which are not very obvious, that deficiency is not very obvious, though overt deficiencies may be there. Whenever there is malnutrition. Malnutrition is a proxy indicator of vitamin A deficiency. If there is malnutrition, vitamin A deficiency ought to be there. But certain overt signs may not be there, but it's important that we need to recognize that micronutrients have to do with the development of the brain, myelinization, as well as development of neurotransmitters. So that would help in improving the brain development of the child. So if micronutrient deficiency is there at an earlier age, that would have deleterious effect on the child's further development. Iron deficiency is one of the major problems, not only iron deficiency anemia, but iron deficiency itself, that would have contributed to the brain development as well. And the children who do not have adequate iron, they would have poor cognitive, motor, social, emotional functions, and that ultimately is going to have long-term effects on the child. Now, again, referring to the National Nutrition Survey, where these are alarming figures, almost 50% of children, they are having iron, vitamin A, vitamin D, and there are other micronutrients like zinc and iodine deficiency. These are alarming figures, and these need to be rectified. The problem is that Pakistan, low breastfeeding rates over the years, that has actually led to overall stunted growth crisis. Because in the first 6 months of life, if exclusive breastfeeding is followed, that would lead to adequate nutrition of the child, that would lead to adequate development of the child. But as health professionals, we need to improve the breastfeeding rates, and we should not see this situation which is so often seen in the well baby nurseries of the hospitals, where every child is given the formula after birth. Now, this is regarding the breastfeeding figures. Again, National Nutrition Survey, 40%. But after the first 6 months of life, the complementary feeding plays a very, very important role. And in fact, complementary feeding, I would come to that complementary feeding, but another problem in Pakistan is the food insecurity. Despite having the agriculture economy, it's very unfortunate that almost, according to the latest nutritional survey, almost 37% of our population is extremely food insecure. That would mean that they are not meeting even the bare minimum requirement of having 1700 calories per day. Then next, the problem which we face, that is the vaccine hesitancy. We know that vaccine is the invention of the modern science, and after the safe water, the major savior of the human being is vaccine. But unfortunately, Pakistan, despite having very robust, very good EPA program, Pakistan is also standing amongst the other nations as in terms of the vaccine hesitancy, and the target is not being achieved. Overall, WHO is concerned about that, and the WHO has put vaccine hesitancy as one in the top 10 important causes of the problems related to the child health. Now, it's always true that if the mother is healthy, she would give birth to a healthy baby. The overall, starting from 2000 to the current 2020, though there has been improvement in maternal health, and the maternal mortality ratio has now dropped down to almost 154 per 100,000 live births. But still, these are large numbers. These are quite a few number of deaths, and which need to be avoided, because death of the mother, that would affect the whole family. It's not that women are dying because of diseases which are not easy to control, or which not easy to treat. But the problem is that the state is silent. State is very ignorant, or I would say that oblivious of the problems of women, and that is the reason that women are, besides obviously the other problems as well. Pakistan's resources are being utilized by the ever increasing population. So as regard the per capita income, as you are all aware that when Pakistan came into being, Pakistan had per capita income later on equal to the many countries which are now very well developed. But over the years, with increase in the population growth, we have seen that the resources are less and these are being consumed by ever increasing population. On current figures, you would be aware, the latest census, which is the digital census, that is the 241 million. Now that is the latest figure, with the growth rate of 1.98%. Now, beside these major challenges, there are other challenges which sometimes come into picture, sometimes they don't come into picture. One of the major problems is the production of child abuse and neglect. We have seen improvement in Pakistan as regards the awareness of the people, and after the formulation of the hospital child protection committees, thanks to the child protection and protection against abuse group of Pakistan PPA, of which Professor Tahir Masood and Dr. Naeem Zafar, these are the, along with other people, these are the stalwarts in that campaign. So this has improved, but this is the one problem which I would say that is still being neglected and overlooked, though the legislation is there, but these are not properly implemented. Child labor is a curse, because that would deprive the child of his childhood, deprive his dignity, and would deprive him from education. But the important thing is that the poverty is the major factor, because that would push the child to ultimately work. Early child development is very, very important, because once the child is born and he needs to be looked into, so that if anything goes wrong with him in terms of his development, that is being appropriately held, and early child development interventions need to be in place very early. And this is important, especially in the first 8 years of life, more so in the first 2 years, but it's important even afterwards. Environment is often forgotten. Environment, we are all aware, the air quality in Pakistan, in the various cities where we are not able to breathe, and that would have effect on the various diseases which are there, and that would have effect on the child's ultimately various development as well. One of the activists of the environment and child health, while speaking in in United Nations Assembly recently, she was a teenager, said that adults have robbed them of their future. So they should beware that what they're doing in polluting the environment. Child marriage and teenage pregnancy, though the legislation is there, but still these are the problem. The other problems which are generally, they're not coming into picture, one of these is childhood cancers. Besides other NCDs, childhood cancers, because 80% of childhood cancers are occurring in low middle income countries. And these are leading to almost 500 to 600,000 deaths per year in these developing countries. So this also needs to be addressed. Now, how can we combat these problems? These are the problems which are there, and we need to analyze those, but how? And that is because at times the treatment of the problem is not there. With adequate treatment is not available, or treatment, if that is available, that is not within the reach of every person. So it's important to lay emphasis to prevention. And as pediatricians, we are always advocate of prevention, because prevention is actually early detection of a problem, and so that early to do some intervention which would prevent the problem, or the problem is not allowed to get worse. And after, once you have identified the problem, you need to intervene so as to provide support at the earliest possible stage when the problems are occurring. And these preventive programs are universal, and these need to be implemented throughout. Now, child health strategies are that we need to protect and improve health of children, and more than half of the child deaths and problems are due to conditions which can be easily prevented or treated. By reviewing the problems which are there, we know that this can be done, and reduction in mortality has been achieved by, if we define the problem, if we analyze the problem and then if we devise plans so as to combat those problems. And prevention is the key in many problems of the children. Now, again, one should understand that we should get out of this notion that lot many resources are required to do all these things which are being advocated. If we follow the simple, very simple solutions, we can actually solve these problems. And these simple solutions, almost 65% of cases, under 5 deaths can be prevented. And this is by health promotion, improvement of mothers and children throughout pregnancy and early childhood, antenatal support and maternity services, child nutrition and breastfeeding support, child health screening and surveillance services. Child health screening, though we do not have any neonatal screening program, but these need to be there so as to especially identify or the diagnosed problem like hypothyroidism in the neonatal age. Then the child immunization services and child development assessments. These are all very, very important. So, what are the principles of child health services? That there should be actually a national strategy. This is everybody's job. Everybody, the whole government, community, as well as various NGOs and etc. or healthcare workers. It's the job of everyone that he has to play his role, and it's important that community-based early intervention and preventative healthcare should be provided. And another thing is important, that there should be a continuum of service. There should not be any segregation. So all these services should be integrated. Now, how can we improve the maternal and newborn health? We know that in every pregnant woman and a child in first 2-3 years of life, he has he would report to the health facility at least 20 to 25 times during this period. So, the clinicians, physicians, pediatricians, they should take this opportunity and they should make every contact count, so that the mothers are advised accordingly, so that the children, as the child health should be addressed, and to identify the problem, and these should be rectified. Deliveries should take place at healthcare facilities with a better enabling environment, or at least at the hands of skilled birth attendants. It's not possible to conduct deliveries at the healthcare facility, but at least there should be a trained skilled birth attendants. As you have seen over the years, this has improved in newborn care. This is a challenging situation in Pakistan to combat newborn care. Newborn care is very, very important, and if we want to pursue the sustainable development goals, we have to reduce the infant and the neonatal mortality to 12 per 1,000 live births. You can well imagine that how stiff this target is. But regarding the newborn care, increasing access to antenatal care, facility-based delivery, availability of and access to quality inpatient care, highlighting the kangaroo mother care, and the integration of the kangaroo mother care into the across various neonatal intensive care units, and the capacity building of the individual who are taking care of the newborns. The important thing is that there should be a continuum. This should not be in isolation. So, starting from antenatal care, immediate newborn care, and ultimately the postnatal care, all should be delivered to the child, and it should be a continuity in the care of the child. Mother's health secures the child's future, and we all know that a healthier generation tomorrow depends on raising the strong girls today. As Napoleon Bonaparte said, that give me good mothers, I shall give you a great nation. So you need to invest in the maternal health, and you should also realize the importance of the first 1,000 days. This is always talked about, and these would start from when the mother conceives, and then in the first 2 years of life. So all these things, that exclusive breastfeeding, later on the complementary feeding, and then the child is taken care of appropriately as regard the nutrition is concerned. And the complementary feeding is a period which is very, very important, because this is the period about which we are not very careful, that once the child's needs cannot be met by the mother, by the milk, uh, we need to supplement by the foods which would ultimately provide him the overall nutrients. So complementary feeding between, especially between 6 to 23 months, is very important. And this is the time when stunting has the highest risk. Complementary feeding should be advised at 6 months of age, when the child is able to control his head, he is able to control his movements, chewing movements, etc. So these things are important, and one should not delay the introduction of even the foods which are potentially allergenic. So it's important, and also the pediatrician should be aware of the diversity of food, minimal diversity of food which needs to be there, how much different food items need to be given to the child after the first 6 months of age, because this would ultimately affect the overall child's growth and ultimately development. Early childhood development, that also needs to be focused upon, because if the child is not developing, he is not achieving his milestones appropriately, this should be intervened, and both cognitive, linguistic, and social and emotional development, that should be seen. And if we take care of these things, if you take care of the cognitive, behavioral, and social, emotional science, things of the child, especially in the first 8 years of life, you can prevent many of the problems. You can prevent the crime, violence, antisocial behavior. You can ensure the mental health being, and you can also avoid the malnutrition in the form of obesity, etc. Child protection and child rights, I've already alluded to that, but this is important, that we need to protect all children from all forms of violence, neglect, and exploitation. And hospital child protection committees which were formulated, that has been a good step, and which would investigate the children, would highlight the problems which have been there. But still, we need to make legislations which are effective, which are enforced at all levels. And this way we can improve the child rights and child protection. Improvements in the social determinants that play a vital role in the child's health, and poverty alleviation, because poverty has to do directly with the health of the child. Maternal education, by studies this has been shown that mother who is educated, even at the level of secondary level, she has, if she gives birth to a child, that child has 2 times more chances of survival compared to a mother who is illiterate. And this goes to 3-fold higher in education, which is post-secondary. Birth spacing and family planning, at least 33, the WHO recommends 33 months of spacing. So this is important, because that will also improve the maternal health as well as the child health of the child. Now, the problem is that whenever there is poverty, if someone falls sick, so either they would sell their assets and become all the more poor, and they would not follow the treatment, and that will lead to the child mortality. Social health allocations, if we see over the years, in the past 6-7 decades, there have been dips and up, but overall the social the spending on the health sector, that has been less than what is recommended by WHO, which is 6%. So with the result that if that required funding is not there, so the health sector and education, that suffers, and that would ultimately translate into the poor delivery of all these services. Important thing is that though we have very vertical programs which are working independently, and we need to integrate those programs. So all these programs need to be together, so that there is a continuum of preventive and curative services according to the needs over time and across different levels of health system. We are well aware of this pyramid, and that most of our services, there is inequity in the healthcare. Most of our services are concentrated in the areas which are, so to say, which are less populous, because the facilities are more in the cities, whereas the population is more dense in the urban areas. But if we see our health system, which on paper is very good, starting from the basic health unit to the rural health center, primary health centers, ultimately to the Tehsil or district headquarter hospital, or ultimately tertiary hospitals. If we see that system, so it should not be like this, that a person sitting at the remotest area, he would be ultimately going to the tertiary care hospitals even for minor ailments. He would present from a distant place, and that would he would go for even for a minor ailment to a tertiary care hospital, which would jeopardize the health, the care, which would use the resources which can be easily used on certain other aspects. So it's important that almost 50 to 60% the problem should be tackled here, and if at all referral is considered, this should be done at the district level hospital, and only 5 to 10% ultimately should be going to those areas where, obviously, considering that these are few hospitals, which are like the children's hospital, which is catering to the needs of the whole, almost whole province for specialized services. So those services can be effectively utilized. The motto of the primary health care is that at every district level, there should be, that should be strengthened, so that takes care of its own people. Now we have teaching institutions, we have medical colleges at district levels. So it's actually the time to build these, to improve the capacity of these hospitals, so as to take care of the people at that particular level. They don't have to go to even for a moderate problem to the tertiary care hospitals. Now, health profile of people of Pakistan will dramatically change if we follow these principles, and even we would have contribution from the rural health services ultimately towards the improvement of improvement of the country. Now, at the end, I would just recite a kata from Iqbal. ढूंढने वाला वो सितारों की गुजरगाहों का, अपने अफकार की दुनिया में सफर कर न सका, जिसने सूरज की शुआओं को गिरफ्तार किया, अपने घर की शबे तारीख सहर कर न सका। देख खुर्शीद तरक्की जरा इंसाफ से कह, मेरे घर में भी तेरी कोई किरण आई है. So we have all the resources, but look at this figure. This is the actually just 5 days ago. This was the happening in Tharparkar. Remember that in Tharparkar, infant mortality rate is still to the extent of 110, 120. You can well imagine that, or even within the same country, there are disparities in the regions. What is the fault of these people? They have equal right. So in Tharparkar, this is a child who is carrying the picture of his parents, the mother died of electrocution and father committed suicide. In Tharparkar has one of the highest rates of suicide in Pakistan, and that is primarily because of economic factors. So if we do not address these issues, we ultimately would not be able to improve our childhood. Now, still in this day and age, the commonest cause of death in a child with diabetes is not from some other thing, but from lack of access to insulin. It's not because of some other thing. So basically, resources are not there. And who is to be blamed? It's difficult to say, but you can say the state of affairs, that the future of any nation lies in the leadership, what choices leaders make. If they make the choices of their child health, child cannot wait for tomorrow. Child has to be given whatever treatment, whatever intervention needs to be done today. He cannot wait. So you can always use resources where these are best required. Thank you very much. Best required. Thank you very much.